Let me get my things pulled up. Wonderful. Well, Sandi, thank you so much for joining us today. We really appreciate your time and your availability. I hope you and your loved ones are well all the way in Flagstaff. That's where you're joining us.
Absolutely. Thank you so much, Gabby, for having me. And yes, Flagstaff is beautiful today. And I can say with confidence that my family is safe and healthy. So thank you.
I'm happy to hear that. Well, and thank you everyone for joining us today. Octavia and I will be leading this discussion. My co-host, co-worker, Zoom extraordinaire, Octavia.
Partner in crime.
Excellent.
So thank you all, and let's get started. So Sandi, can you please share with us your own cancer journey and what type of cancer you were diagnosed with? Now that we've had a series of Let's Talk About Cancer through the past couple of weeks, we really want to hear about your own journey.
Absolutely, Gabby. Well, my journey with cancer started over 15 years ago now, in 2005. And at that time, I was a working mom. I had just started a new job running a nonprofit organization in the Phoenix area. I had two children, young children, a 10 and a 7-year-old at the time, and a husband that worked and commuted to Washington, D.C. for his job with Indian Health Service. So our lives were very full and very busy. And I thought I was healthy. I had no symptoms. I was not ill. And I had a growth on the very top of my head in my scalp. And what I didn't realize when I went to see the dermatologist about that growth was, unfortunately, it was cancer. It was melanoma. And the melanoma had already metastasized and had traveled down my scalp behind my ear and was headed toward the rest of my body. And the only clue that I had before March of 2005 was the prior month, I woke up in early February with a large swelling under my ear that was very painful to the touch. And as a result, I had contacted my primary care doc and asked to get in. They couldn't get me in right away, but about 2 days later, I went in, and at that point, the swelling had gone. There was no evidence of any infection or anything else that they could identify. So they kind of gave me a, you're okay, we're not sure what that was, and off I went. So it was many, many weeks later and completely unrelated when I learned that I had melanoma. And at that time in my life, I was just stunned. I was shocked. I had no symptoms, was very healthy, and to be told you have cancer and that you need to go into the hospital right away was really stunning for me. I had a hard time processing that information intellectually at that moment. I think it took me months, honestly, before I really was able to reconcile that diagnosis, but I didn't have time. At that point, I was referred into my healthcare hospital. I was in surgery within a week, major surgery, and they were able to take the primary site of cancer and excise it. But in order to do that, they also had to graft skin onto the top of my head. And I laughingly, especially with young children, tried to explain that I'm from the Saturday Night Live generation. And there was a skit on Saturday Night Live called The Coneheads. And the Coneheads were hysterical. And they had these heads that went up like that. And that's what I looked like when I left the hospital. So they had sewed this contraption onto the top of my head, and it went straight up and pulled my scalp together. And I was walking around looking like a cone head. And at first, I think my children were just like, oh my goodness, what has happened to our mother? But we'd laugh about it, and we knew that it was temporary. I had it for, I think, 7 weeks attached to my head while the skin graft started to heal and take. And I was so fortunate that my healing at that time really went without any complications. So I was very, very lucky. But needless to say, I didn't leave the house much. Kind of reminds me of COVID, where you have to stay home. I think I would have shocked a lot of people walking outside with this contraption sewed to the top of my head. But that was my first experience with cancer. And for the next year and a half, I had radiation treatment. I had a subsequent surgery because at that time they realized that the cancer had spread into the rest of my body and that we needed to be as aggressive as possible. And I also then participated in over a year of immunotherapy. And I was one of the early adopters of immunotherapy. Most people with cancer hadn't heard of immunotherapy 15 years ago. But for my particular type of cancer, they had some promising clinical results and trials. And I was fortunate enough to be able to get that medication and have a long-term course of immunotherapy.
Wow, that's an amazing story and journey, and so fortunate that we have you here with us today to share that. That's amazing.
Yeah. And for those that are just joining us, we are welcoming here Dr. Sandi Perez from Cancer Support Community. She's a chief operations extraordinaire as well in the Flagstaff area for Cancer Support Community. So what a journey it has been. Even 15 years ago, I can only put myself in your shoes, having gone through that journey with your family. So thank you for sharing that.
Absolutely. Absolutely, Gabby.
Yeah.
Well, couldn't have done it without my family.
That is amazing. Yeah, and so that was my next question for you. What was your support system like? I imagine processing that would be tough, and you would need to lean on loved ones and family members, but I'm sure that was tough as well. So could you describe kind of what that was like? What was reassuring, reaffirming for you? What did you want to hear from people, and what did you not want to hear from people?
Well, I think it's so critical to reach out and include your support system and not isolate yourself when you have a diagnosis of cancer. I think a lot of people feel so alone and feel that they're the only person really going through this, when unfortunately so many of us are touched by cancer now. And the good news is we're surviving and thriving through cancer, even for some of us who have had it multiple times. So building your support group, if it's not strong enough, reaching in and making sure people understand how you feel to the best of their ability. It is a very isolating experience. It's very overwhelming. And we all have different ways of coping with it. I was lucky because my husband is in the psychological field like I am. So he had a good preparation for it. But at the same time, we moved to Arizona and don't have family in Arizona. So we didn't have our extended family close. And this was at a time where we didn't have Zoom, we didn't have video chat, we had telephones. So I'm not going to date myself that far back, but we really had to reach out and use the phone and bring our family in and share the news. But it was my friends and my therapist. That was the first thing that I did for myself, is I went and got a one-on-one individual therapist who had experience with not only cancer, but fortunately my type of cancer. And so she well understood some of the issues that I was going to face and did face. And she was enormously valuable to me personally. That was my safe place to talk about anything that was on my mind, anything that worried me, anything that I was reluctant to share, even with my best friend, even with my husband and those people closest to me. So that emotional and psychological support was just invaluable, just invaluable. And that was equally true when I had a recurrence of melanoma 6 years ago. So those same things came back into play when I became very, very ill 6 years ago, and the melanoma had traveled into my intestines, and I had to go back in to treat the melanoma at that time. So the emotional and psychological support that I got from friends, from family, but also from the professional field of mental health was really critical, I think, to my recovery and the fact I'm still here.
And did that ever change over time? Like, were there times when you wanted to be closer and connected? And were there times when you wanted to feel more like that isolation that you mentioned? Did you feel a need to combat that? Like, were you conscious about, oh, I don't want to be feeling this isolation? It sounds kind of like it could be a mixed bag.
Absolutely, Octavio. I think that you experience so many different emotions, and I always think of it like a roller coaster. I'm going up and down and up and down, and some days I feel exhilarated and optimistic and ready to face anything, and other days I feel very low. And sometimes you can't predict that. You have no idea when you wake up in the morning how you're going to feel that day. But I know there are things we can do to help ourselves. And those things, many of which I, as a psychologist, had the good fortune to learn in graduate school and preach, if you will, and share with my clients. I really needed to take a hard look at that and say, okay, you got to walk the walk, you got to talk the talk, you've got to practice the very things that you know help people. And for me, those things were exercise and movement. I couldn't go out in public with my cone head, but I could practice things like yoga and Tai Chi, which I love, things that were more relaxing, that weren't as rigorous, things where I didn't have to put my head down, needless to say. I also knew that deep breathing exercises, relaxation like meditation, and for me, visualization became very important. I spent time every day, and still do, thanking my body for being so strong and so resilient, and also focusing on all the good energy and healing that my body has in it to be the best person and the healthiest person I can be every day. So I know that that visualization of healing and optimism and love, all of that helped my recovery. And I would literally visualize my scalp knitting back together and all of those stitches kind of working their way together and healing and being strong skin again. And I would visualize my blood being healthy and strong and vibrant. And I know that those exercises, if you will, and that focus of energy and healing and love really speeded my recovery. So those were things I had learned in school, if you will, and in my training, but they were things that became very important to me and continue to be in my recovery and in my life.
Yeah. And Sandy, you mentioned this previously, but as a clinical psychologist, you already had a plethora of knowledge on how to maybe navigate through these emotions. Do you think that maybe understanding your own greater knowledge helped you navigate and help others with their own recovery and being a part of the journey that they experienced and how to help them through that?
I think so, Gabby. I think it helped. I know it helped me face this in a more positive way and not feel as helpless. I think that we feel really helpless and out of control when we hear that word cancer. And it's so overwhelming and startling. But I knew if I could take control and do things to help myself, that would make a difference. I didn't know how much of a difference it would make, and I certainly didn't expect to be here 16 years later, but I know that was part of my ability to walk through this experience in this journey. And I think to be a better person and certainly to be a better therapist because of that experience. I think that has really helped me understand it at a real gut level. And it also helps me understand what people don't want to hear when they have cancer. It's very uncomfortable for our friends and our families sometimes to know what to say. It's hard. They want things to be better for us. They want us to be happy. They want us to feel better. And they can oftentimes minimize your feelings or disregard them unintentionally. Say things like, oh, it's going to be fine. It's all going to work out. Give you platitudes when none of that is certain. And it's better to face the uncertainty than it is to try to make light of it or discount someone's feelings. I think it's really important sometimes just to be there for a person with cancer, whatever that place is, whatever they're feeling, whatever they're experiencing, just to be there with them and to ask if there's anything they want to talk about or not talk about.
Mm-hmm.
And I think those things are equally important. We need to honor each other's experience and appreciate where they are and allow them to be where they are. Obviously, we're going to be watching for more extreme forms of depression, isolation, suicidality. Those are things that we know cancer patients can be at higher risk for. So when I have my clinical hat on, those are things I look for. But as a person who's survived cancer, that's what I call on in my heart when I'm talking to other people facing this disease. So that's probably a very long-winded way to answer your question, Gabby, but it did make a difference. I think my training made a difference for me, but I also think my personality and my God-given sense of optimism that life is good and here for us to partake and enjoy also made a big difference.
Yeah, and what a special way for everyone at Cancer Support Community in Flagstaff to feel the same support that you provide to them, because you have a background in what they're feeling, and you can really connect with them further to navigate their own issues or their own headspace that they're enduring. So kudos to you for everything that you continue to do for that community and for the folks and families that are experiencing cancer in a loved one.
Well, thank you. Thank you. I think our motto is at Cancer Support Community Arizona, no one should face cancer alone. That is critical to us. We know that there are things that we can do to share this experience, and there are many of us now who share this experience. And even though our cancers might be different, our treatments might be different, there are some shared experiences, lived experiences that we have where we do understand some of the challenges. And I was talking to somebody recently who said, you know, the medical treatment is the medical treatment. You trust your doctors, you work with your healthcare team, you put together a plan of treatment, and you make it happen, you go through it. But then there's the other part of the treatment, and that's in your head. That's what you are calling your headspace. That's the mental and emotional resources and skills that we have to really pull together for ourselves to face this disease. And one of the women that I work with here said that's 90% of what's so challenging is the mental and emotional stuff. Because if we're lucky, we get out of medical treatment, and then what? Then we're really facing the emotional and mental challenges of having cancer and being a cancer survivor or being a cancer thriver, whatever word that you use that you're comfortable with. I think that's where it becomes emotional and mental and spiritual. And that's where we have to use all of those resources that we have. And if we don't have enough, we got to build them. We got to learn new skills. We got to try new things. And we have to keep moving forward in this journey.
I think that's an amazing perspective that you bring to this. And I wonder, you know, how behavioral health, emotional well-being, the things that you mentioned, how those can be kind of placed on the back burner because, as you said, we got to think about treatment. How are we going to address this diagnosis? But there's almost like a hierarchy of needs that we establish there. But we have to keep in mind that is, like you said, 90% of the journey it can be. So have you noticed a shift? Should there be more of a shift or a consideration giving to that aspect of the journey?
I think in the last 10 to 15 years, but certainly the last decade, we have begun to not just only see the research around how important the emotional, psychological, and mental health aspects of cancer recovery are, but we're also getting it verified through the institutions that we are esteemed institutions in our country, like the Institute of Medicine. So in 2007, they published a really seminal report that talked about how important the psychological, social, and emotional aspects of recovery were. And they called it psychosocial services. And that's exactly what Cancer Support Community Arizona offers. What we focus on is how can we help people feel less alone and connect with each other? How can we help them improve their quality of life at whatever stage of recovery they're in by providing immune boosting workshops, educational information, and also social opportunities. Sometimes people do feel like I did with my cone head, I'm not going out in public. I'm not sure how many people I'm going to let in my house to visit right now, but you move through those. We know being social, we're such social creatures by nature. And I think that's one of the things this pandemic has really highlighted is how much we crave that social interaction as people. And it's really hard for us to stay away from each other. And that just really shows that fundamental need and motivation that we have to be together, to be in family units and friend units and be a community. And that sense of community is another aspect of our recovery, and certainly our work at Cancer Support Community. That's part of our name. The 3 words in our name tell you what we do. We're all about cancer, any type of cancer, any stage, any age. But we're also all about the support that people need. And that support comes through having fun, doing activities together, learning new skills together, as well as being able to talk to each other about those deep, intimate, hard things, hard questions and hard issues that we face. And then we want to create a sense of community so people don't feel alone. And I worry a lot right now about many of our cancer participants who are literally by themselves in their homes because it's too dangerous for them to go out. Many have immune systems that are compromised and are in treatment or recovering from treatment. So they need to stay inside, but being alone is not our natural state. And so we have to create that sense of community, even if it's a virtual community right now, until we can come back together in person. So those 3 things I think are really critical. And now that we've got the Institute of Medicine and other organizations focused on these kinds of issues, it's coming, but the focus still tends to be on medicines, treatments, procedures. The healthcare system is really much more about the medicine and not about the rest of our recovery. So we're always working toward greater integration between the healthcare system and the psychosocial system.
Mm-hmm. And along those lines, what therapeutic modalities do you recommend for cancer survivors specifically?
You know, that's really individual, Gabby. I think we know that exercise and movement will help build and release endorphins, and endorphins help us feel good. So any kind of exercise you can do, walking particularly is wonderful, but also dancing, yoga, biking, people set all kinds of goals for themselves to exercise. And we know if we can exercise every day, that's so important. Not all of us are as verbal as I am. Obviously, I love to talk. That's kind of part of my job. It's a good thing. But some people express themselves in other ways. They paint, they create things, they write stories and poetry, they play music. We all have different ways we express ourselves, so we need to reconnect. If we're not connecting with those or using those ways, we need to reconnect and do the things that allow us to express our feelings and get those outside ourselves so they don't fester inside our heads. So all of those kinds of modalities are really helpful. So we have a drumming class at Cancer Support Community that's really, you don't have to have any musical talent to bang on a drum, but let me tell you, it feels good. It feels really good. You don't have to have artistic talent to make a picture, or right now, people are sewing masks. They're using all kinds of different creative ways. Gardening's a wonderful thing to do. Caring for your plants, walking with your pets. Someone I talked to recently said, you know, I've been waiting to get a dog. I was waiting and waiting because I had this class reunion. I'm not waiting anymore. I'm going to go out and get a dog now. And I was so excited because a dog, you have to take care of them. They're wonderful social creatures, but also they help us get out and walk. We got to take care of them. We got to feed them. We got to get them outside and walk. Those are things that are good for us. So, and then there's the cognitive things that we can do. So mindfulness is a very, very powerful technique. to help people really be in the present. We tend to get anxious when we think about the future. And oftentimes we get depressed when we think about the past. So really learning to manage both our sadness and our anxiety and worry are very important skills. And mindfulness can help us do that. Meditation can help us do that. There are other stress reducing techniques. And just breathing, making sure we're breathing deep is so important. So those are some of the modalities that I think I would recommend, but not specific to any particular person. I hope that makes sense.
Yeah, absolutely.
And then I was wondering about, and maybe this could inform like what type of therapy or approach, about trauma and perhaps PTSD, post-traumatic stress disorder, and how that could be something that can be experienced just by the simple fact of being diagnosed with cancer. Is that something that you've seen in your experience, or that maybe there could be some more light shed on that with some of the research going on? Curious about your thoughts on that.
Absolutely. So I think post-traumatic stress disorder and some of the other similar or co-occurring types of disorders that we often see with PTSD have some symptoms that are similar to things that we experience when we're diagnosed with cancer and facing cancer. And I know for some people, different smells and different visual stimulation can trigger those experiences. And so we have to be aware of that. And we, again, have to understand ourselves and what our coping mechanisms tend to be, so that if we see changes, we'll be able to identify them. So although they're not the same thing, I think that there are some symptoms that people can experience sometimes. And I think that we in the cancer care community, there's a lot of us that get some anxiety when we go in for our medical checkups. And we have a term for it. We call it scan-anxiety. And that anxiety that we feel is oftentimes related to the MRIs, the PET scans, the CAT scans, all of the tests that we go through to find out if our condition has changed. And there's a lot of worry and a lot of anxiety that goes with that. So I think it's really important I like having a name for it and labeling it, because it makes it a real thing. And it's something that many of us experience, and it's something we can talk to other people about. And we have to be able to educate the people around us too about what we're feeling. I've recently had someone say, do you still get anxiety about your upcoming medical checkups 6 years later? And I'm like, absolutely. Absolutely, I get that anxiety. And I know it's coming. And I know there's certain things I need to do to help myself to make it through. And also to give myself a break if I'm cranky, if I don't sleep well the night before. Those are things that are normal and to be expected. And I have to allow myself to experience those things as well. And to also make sure that my kids and my husband and everybody knows I'm really cranky right now because I got a scan tomorrow. So it's good to share that. It's good to help them understand what you're experiencing, because the further away you sometimes get, the less people connect you to having cancer, especially if you're doing really well. And with skin cancer, with melanoma, people often think skin cancer is not as serious. And I had many people say to me, oh, you look great. Like, I shouldn't look great. And I think it was because of the fact that there's this perception that skin cancer is something you just cut it out, it's not a big deal, and it's over. And for most people, thank goodness, that's the case. But I didn't lose all my hair. I lost a big chunk of it. Still don't have that hair left back. That'll never come back. But fortunately, as you can see, I got lots here. I got plenty. But I didn't look emaciated. I didn't look sickly. I didn't have the appearance of what people expected someone with cancer to look like. And that was hard for people. And they tended to discount what I was going through because I, quote, looked good. So those are interesting aspects of cancer, and every cancer is different, and all of us have different side effects and long-term effects, not just short-term, but long-term effects that we deal with. I don't have any feeling in my ears and the right side of my neck because of the surgeries and the nerves that were cut. And there's other many long-term kinds of things. But for me, the hardest thing I faced was in my radiation treatment, losing my voice, not being able to talk, not being able to eat or swallow, having terrible infections and burns in my throat. Those were really hard things, but nobody could see them because they were all inside my body. And many, many cancer people facing cancer have those kinds of things internally that people can't see. And I think it's important to talk about those things too, and to share those things.
And also, I think it would be essential for providers to keep that in mind, right? So that the things that you're touching on really relates to, we had Dr. Jennifer Erdrich on Let's Talk About Cancer, and she was talking about, well, both how surgery for melanoma can be quite serious. We think of it as just removing a mole, but it can be an intense thing to go through, but also to have in mind that someone might need you to repeat something when if you're a doctor and you're giving some information to a patient, they need to process all that. They might be going
Absolutely.
through a fight or flight reaction. And it's important also to listen and to be willing to sit with a family in silence and to, you know, repeat yourself as many times as they need you to.
Absolutely. I have a story of a particular MRI experience, and I had a very, very lengthy MRI, almost 2 hours, and I'm a little claustrophobic, actually probably a lot claustrophobic. So an MRI experience is always difficult for me. And the technician, I told him ahead of time, I said, I am not happy being confined in the MRI. I really hate that you're putting a cage around my head and neck so I can't move. And so you're gonna need to tell me how many series we have and where we are in the series and how long it's gonna last. And he said, well, that's gonna take too long. And I said, well, okay, here's the deal. You either please tell me, or we're going to have to stop and start and stop and start, and you're going to have to take me out of the machine till I calm down, and then I can go back in, or we're going to have to reschedule this and I'll need a different technician. And he kind of looked at me like, you're a really bossy lady. And I was like, yeah, because this is hard for me. This is really hard. And he did it, and it didn't take more than a couple of seconds to tell me and communicate with me during that process. I still was exhausted because I had been arguing with him before the MRI started, but I was grateful that I was able to communicate to him what I needed in order to make that test successful and to get through it, because I definitely didn't want to have to come back and do it again. And I didn't want to have to come in and out and in and out of the MRI machine through the whole thing. So being your own advocate and your own champion is so important. That would probably be the number one thing I would share with people, is that nobody cares as much as you do about your cancer journey. So you need to step up and ask questions. You need to have people there with you to help you record, write down all the things you learn. Because as you said, Octavio, you don't process everything when the doctor says it. And you don't think of all the questions you want to ask right in that moment. So we really have to be our own champion, our own advocate. We've got to take control for ourselves. And we have to ask those questions. We have to prepare ahead of time, write down the things you want to know, do the research, go in with a list of questions, make that doctor sit down and talk to you and answer your questions. And if they can't, fire them, get a new doctor. And I did that too. And that was really hard. That was very early after my first diagnosis and course of treatment. And I talked to the nurses, I talked to the doctor, and I talked to the hospital and said, this is not working for me. I need a different doctor. I am not getting my answers. I'm not getting my questions answered. I feel like they just want to put me in a clinical trial, and that's not where I am. And so I was then able to get a new doctor, and my course of treatment was much more successful. But that was really hard. I really struggled with getting a new doctor. And yet, in the end, it was the best thing that I could do for myself and my recovery. So I would strongly encourage people to take control of their healthcare team and to be clear about what they need and communicate that, even when it's hard, even when you're exhausted. And if you're too tired, make sure you've got a friend, a partner, a spouse, a family member who can be that person when you're too tired, when you're exhausted.
Yeah, and I like how you mentioned it's important to be your own champion through the emotions that you're experiencing of someone that has to go through these appointments, do it alone, and we're wondering, with that, do you recommend, or do you know of any good recommendations for online services of counseling and therapy, especially now during this pandemic? As a clinical psychologist, I'm curious if you've had to move your own services and resources through an online service, and if there's any that you would recommend for others.
That's a great question, Gabby. We at Cancer Support Community, many people may know, but just in case, we're a national and international organization. So there are 47 cancer support communities, most in the United States, a few in Canada, a few in the UK, Japan, Israel, so a few outside of the United States or North America. And in mid-March, as a group, we collectively decided to move all of our services to the telephone or to the computer, to online services. So across the country, we all started working on that. And I'm very, very proud to say in Arizona, we were able to get our programs online within 5 days, which is just remarkable. We have close to 60 teachers and mental health professionals that are now providing upward of 15 different classes, sessions, support groups every week, and in Spanish. So we have some monolingual Spanish support groups for people who are facing cancer, and we have separate groups for people who are taking care of someone or love someone who's facing cancer, because we think there's a distinction between being a caregiver and facing cancer yourself. And we think that both of those things are critical, and we need to honor that and make sure people have a place where they can share, where they can hear also and learn from others and get recommendations from others about their specific challenges. So I'm very proud that we've moved all of our programs virtually. We're also doing individual counseling, and we're doing that on the phone for the most part. Again, we have access to telehealth services. I know that many of the federally qualified health centers are now using telehealth services, and that is accessible to anyone, whether you have insurance, you have Medicaid or Access or Medicare. So those are really important. And there's also many counseling groups that have gone to it. So I can't speak to all of the groups around the state, but I know that some of our groups here in the Flagstaff area have definitely gone to all virtual counseling sessions. And you can do that for individuals, but you can also do it for groups. And we're finding people, once they kind of get through the awkwardness of using technology, are actually getting used to it and feeling like, wow, I can still get support and share, even though it feels really different on a computer or a tablet or on the telephone. So certainly better than nothing, but also it's allowing us to connect to people all across the state. And that has been really remarkable. So people who couldn't travel to our campuses or our offices can Zoom in and participate and learn how to cook healthy foods for cancer. We have many cancer-specific learn and support groups as well. So we have groups that address lung cancer, that address pancreatic cancer, ovarian cancer, neuroendocrine tumors. So we have a wide variety of cancer-specific groups as well. So and they're at no charge. So that's really important. We never want cost to be a barrier to anybody accessing services. So our model is a no charge model. And as a nonprofit, that can be challenging. That means we've got to raise the money. So we ask for support and donations from a lot of people, a lot of companies, write grants, have special events. But we think that is really important to honor that no charge, because we want anybody to be able to access our programs. It's really important. We don't want finances. There's enough financial burden with cancer. We don't want psychosocial programs to add to that financial burden. And many people, their families are devastated by the financial impact of cancer.
Absolutely. And I had previously spoken to the bilingual coordinator here in the Phoenix cancer support community, the wonderful Lisbeth. And she told me about her own personal experience navigating through the Spanish-speaking members and having the conversations through Zoom and through phone call, and the really special moments with the patients telling her that it's so nice to see a friendly face after all these weeks feeling isolated. So it's wonderful that cancer support community continues all of these, all their tireless efforts to reach these members that need the most support and truly value it.
No, thank you. It's really an honor to do this work and to be part of this organization. And we're always exploring new things, and we're doing art classes online, which is really interesting and so fun, even for those of us who have no talent at all. But we're really, again, trying to bring all of these good modalities, as you called them earlier, Gabby, so that people can pass the time in a productive, healthy way. and not sit in front of a television or sit and watch the news or, do things that really are not healthy. We're a little worried that people are eating a lot more being at home. So I've heard people call it the COVID-15 for 15 pounds.
Oh my goodness.
That people are gaining. So I think that, one person said to me, you can either come out of this as a hunk, meaning that, you're really fit and looking good, You can come out of it as a chunk, which is not really the goal here. Or you might come out of it as a drunk, which people are very worried about substance use disorders. So I did not make that up. I cannot take credit for that, but it certainly stuck in my head. And I thought, we can come out of this as stronger, more resilient, healthier people. We can do it. But it's hard. It's hard. That means we've got to get up and move. We've got to get away from the television. That means we've got to do things that are healthy. And I hope that our listeners today can come out of it healthy, not as chunks or drunks, maybe hunks. Hunks would probably be okay, but.
That's too good.
So we still have a few questions for you on our list, but the time has flown by. So I did want to make sure to mention that we have a chat option if anybody wants to send in any questions that they might have before our time here is up. Also, if you want to just turn on your camera or your microphone and go ahead and ask a question, we also have our social media up where you can send in your questions there. We have our upcoming webinars posted on the screen right here, right now. So just wanted to put in a plug for those. Please join us, everybody, if you can. May 19th, we have Ari Rascon. May 20th, Dr. Felina Cordova, who is actually on the webinar right now as we speak. Pedro Molina from Bagot, that one's going to be en español. And then the following. Yes.
Muy bien. That's
Muy
a
bien.
great resource. Bagot is a wonderful organization. It really helps people understand and organize themselves as they go through this cancer journey. They're
Absolutely.
great.
And we have, let's see, Mindy and Joyce on here right now from Bagot. So thank you guys for joining us. May 26th, Rosie from the new Cancer Prevention Research Center that's been established at the U of A in partnership with Mariposa Community Health. Brenda Sanchez and Linda Cifuentes from CHEC, May 28th. On our Zoom chat, we have the evaluations for our red cap. So anything that you guys want to mention that you liked about this particular presentation or ideas of things we can add for upcoming ones. So we will give everybody a moment to chime in if they have anything to add. We want to thank you so much, Dr. Perez, for joining us today. Looking on the questions that we have left, where are you currently with your journey of facing cancer?
Well, I'm very grateful to say that I recently went through a full checkup and there's no evidence of any disease. And I feel good, and I find my work really rewarding, and I'm healthy. And I am just very honored to be able to be part of the cancer care community as a volunteer, but also as a staff person with a wonderful organization and meeting amazing people.
That's wonderful.
That's wonderful to hear.
And to close off this conversation, Dr. Sandi Perez, what 3 things would you tell a person that just yesterday learned of their own cancer diagnosis?
Well, I think a couple of them I've already mentioned. And I think that being taking control of your health care is really important. Sometimes that means not doing lots of research on the internet, okay? Yeah, there's a time and place for research. That was a very hard one for me because I love to read and learn about things, and I really had to stop myself from looking at the statistics, from looking at the prognosis of other people. So believe in yourself and your resources, your skills, your spirit. Believe in that. And take someone with you when you go to the doctor so that you are not alone. Don't face cancer alone.
I like that spirit. I like that as well.
And thank you so much for having me today. I really appreciate it. I think there are times in our journey when we're ready to share our story, and this is certainly one of those times for me.
That is great. Thank you so much. This is great information. Always good to hear about the great work you guys are doing. We did have one question from Dr. Monica Yellowhair on our chat. How can someone volunteer for Cancer Support Community? And I would add, how can somebody donate to Cancer Support Community?
Well, that part's really simple to answer. So if you go to our website, which is the initials of our organization, so CSCAZ for Arizona.org, so cscaz.org, and you can volunteer, and you can also contribute your talents. If you have talents you'd like to share or teach, you can also donate money. And of course, that's always wonderful. And we have a Northern Arizona calendar, and we have a Central Arizona calendar. So that will give you information about all of our virtual classes. We are not yet ready to go in person, but we anticipate that will happen at some point. So more to come on that status. But right now, it's really easy to sign up. We just need an email from you, and you can register for any of our programs, workshops, or seminars.
Wonderful.
Excellent.
Sandi, thank you again. Thank you again for your time, for taking the time out of your day to speak with our own members of your journey, and for all the work that you continue to do. We really appreciate it.
Oh, you're so welcome, and it's so wonderful to see. I'm waving to some of my friends. Snaps and claps to all my friends out there who are watching. Thank you guys so much. Have a fabulous day and a wonderful weekend.
Likewise. Thank you everyone for joining us. Have a
too.
great weekend.
Thank you.
Thank you, everybody.